What we're looking at right now is a medical triage unit for the hospital. So all of those patients, you can't really see them, but there's probably about 200 patients underneath that awning there that are waiting to be seen, as well as all of these patients.
Doing wound care today, and our initial thing is just to evaluate all the patients in the hospital.
Okay. So that's what you've been...
And we're up to about 7 cases for the day, looking at wounds, cleaning them out, and skin grafting them or closing them as they'll tolerate a closure.
You sure it wasn't like that here?
Like what? Like the breakdown here a little bit?
No, it was okay. I mean, I can't remember exactly the picture.
Fortunately, MedShare has provided us a lot of information and a lot of products in order to take care of a lot of these severely injured patients.
Yeah.
So, you know, with corporations and companies like that, I think we'll be able to do a lot for the patients.
Okay, go ahead, listen to it.
Tell me about that patient.
So, this is a young lady who was involved in the earthquake. She had sustained a crush injury to her lower extremity. Her entire family got out safely except her, from what she told us. And she ended up getting an amputation for a crush injury on the right leg. Had some injuries to the left lower extremity. So we went back in, debrided some more. Ended up doing a split thickness skin graft on the left foot and debriding and cleaning up her wound on the left leg. So she's actually doing pretty well. So. He's got an infected leg with a graft, skin graft. He's also got a tibia fracture on there, which we're actually going to take down the skin graft, take a look at that, maybe regraft it, and then take the external fixer off and compact it a little bit so he can walk. Once we can get him up, he also has developed a pressure sore underneath on the back of his head. So if he can get him to walk, he's going to do a lot better.
Stressing here a little bit.
Okay, is he an amputation?
Yeah.
Yes.
And he almost bled.
It sounds as if he was treated by some other surgical group and he ended up having an infection, and supposedly it did what's called a guillotine amputation.
Yeah.
Which they basically do an emergent amputation because he was supposedly he was septic, ended up losing a lot of blood during that procedure. I think he was also anemic prior to the procedure. Right now he looks pretty good though. So we're going to go back in either later today or tomorrow and reevaluate his wound and maybe do a primary closure or secondary closure on his amputation.
You want to tell us what we're about to do here, Dr. Goins?
This young man got involved in a crush injury, had a severe injury to his right lower extremity, tibia fracture, also had sustained a really bad crush injury to the muscle, the anterior compartment, which has been debrided, but now we're going back in to see if we do a second debridement and skin grafting and maybe a delayed primary closure. He was septic before we treated him with antibiotics, but now he's recovering well. So this is our transport team getting him positioned on the table, and then we'll start anesthesia, and then we'll go on to the primary procedure.